Welcome back to all of you. As you know, we have hit the 1-year mark since the pandemic started. So what do we know now that we didn't know then? And maybe most importantly, what's next? Please welcome back Dr. Hilary Babcock. She is a Washington University infectious disease expert at BJC HealthCare. Great to see you again, Dr. Babcock.
Thank you. Nice to be here.
So we want to start off with a question of what is one of the biggest things we now know about COVID that we didn't know a year ago?
Sure. I think one of the really important things that we learned about this virus was that it can be spread by people who are not yet showing symptoms, who are asymptomatic. And that was really a game changer in how we needed to think about controlling the virus and the spread of the virus. That meant that we couldn't just rely on sick people staying home to keep things under control, that we needed everyone to follow these precautions really all the time, because you didn't know whether you might have symptoms a couple days later and have already exposed a bunch of people. And I think we also learned that, the community can really have a big impact. And our community did a good job for the most part, pulled together, stayed home when they were told to, wore masks when they were instructed to, kept that social distancing, avoided big crowds, closed down things when we needed to. And that has really helped in the St. Louis area. While we have had way too many cases and definitely a lot of tragedy for our region and for a lot of people, we were able to maintain our healthcare systems. They were stretched, but they were not overrun. We were able to continue to provide care for COVID patients as well as for other patients. So I think we really saw that power of community coming together.
You've learned a lot, but also what was your biggest concern over the last year?
I think our biggest fear was really sort of understanding how long this might go on. It's been wonderful to have multiple safe and effective vaccines and more on the horizon and more doses being shipped all the time so that we can get people protected. We really didn't know that it was possible to do that so quickly. And based on a lot of research that had already been done and a lot of funding provided by the federal government, no corners were cut to reach this fast turnaround time. We were able to get vaccine into arms, within a year of the discovery of this virus. And that's remarkable.
So Dr. Babcock, what is next in your opinion?
For a little while, things won't look a lot different. As we get these vaccines into arms across the region, we will slowly be able to see, hopefully, continued decreases of case rates. And if the case rates stay low and we can get a large population vaccinated, then we will be able to see some changes. We'll be able to relax restrictions. We'll be able to get together with friends and family again, and be able to have a little more of that social life that we've all missed out on in the last year. And so that will be wonderful. We are not quite there yet. So light at the end of the tunnel visible, still in the tunnel. So we need to keep following these recommendations, still stay safe, keep others safe, wear your mask, social distance, all of those things just for a little bit longer so we can be sure that everyone gets protected.
Well, Dr. Babcock, thank you for joining us once again. Thank you for everything you have done to keep the St. Louis area safe and your entire team. And of course, we will post this segment on KMOV.com/greatday following the show.